All right. Well, I'm really excited today to kick off my inaugural podcast, Diagnostic Guru, with a rock star woman in science. I've had the honor to know and work with since 2016. And coming off a pandemic and reaching heights in diagnostics, I'm excited to introduce you to today Dorottya Nagy-Szakal, otherwise goes as Dora. Dora, who is a diagnostic guru in her own right, has her MD and her PhD. She leads teams that develop and commercialize transformative translational medicine in molecular diagnostics, infectious diseases, and public health. At her current position as Chief Medical Officer at Biotia, Dora provides clinical implementation of microbiome and virome data using novel sequencing-based and AI-driven technology. What is that? Well, we're going to get into it for those of you who are non-scientists listening. But the most impressive is that she built a high complexity diagnostic lab in New York during the heights of COVID and received the first FDA EUA for COVID-19 variant detection software. So help me in welcoming today Dora, our first diagnostic guru. Dora, welcome. I'm so happy to have you.
Very nice to be here. Thank you so much, Leslie, for inviting me. I'm very excited to start this conversation.
Wonderful. Well, let's start with the good, shall we? So let's start with what is one of the things that you would love to share with the audience that you're really proud of in your career to the state?
Okay, so let's start with I think I like to collect letters after the end of my very long and complex name, but I'm very proud I became an MD and PhD, and this really helps me to drive me through my career and have this more integrated and comprehensive understanding of the human body and understanding the whole workflow around research and how we can work together with different scientific fields to support the human health. So I think that's definitely a component. What I'm also very proud of that I'm an immigrant. So after medical school, I came to the US when I was 25, completely alone, and almost had to
Wow.
restart my whole education and career to reach the point where
Wow.
I am. So that's something that those skills that I learned through the process, I think really helped to achieve where I am right now.
Wow, that's incredible. I mean, it's too bad that you can't translate a lot of that over across waters, right? Even though the foundation is the same, our systems are different. And so I'm sure that's a lot of the retraining or additional educational work that you had to do in that
Absolutely.
situation.
Yeah, let's just start with that. We learned everything in Hungarian language. So I was speaking in English, but to learn and comprehend the knowledge in the English language, that was one of the challenges. Then understanding the healthcare system, that's completely different. And I feel
Oh, yeah.
still learning up to now how the US system works is quite challenging, but also very exciting because I can learn every day something new.
Like, I feel like we should put a squared next to your degree, like MD, PhD squared, because you had to do it twice. So impressive, to
Thank
say
you.
the least. Um, let's get more into really what drives you as a clinical medical scientist and talk more about the groundbreaking diagnostic work that you've done, specifically around the FDA EUA for COVID-19 variant detection software. And what does it feel like for you to see your work actually directly impacting public health and patient outcomes?
So it was quite exciting at that time when while many people were watching Netflix and staying at home, we have been working over 16, 20 hours
Wow.
to be able at that time our new Biotia received the New York State CLIA laboratory. So we were able to do infectious disease diagnostics and complex molecular diagnostic testing. And also with many of the data and the genomic data that we built, we were able to build a platform that's called Geosic that can really help to do genomic surveillance from all over the world. One exciting
Wow.
thing that happened, I felt like the whole globe came together. So that was really
Mhm.
good to see that the virus didn't have borders. The scientists didn't have either. We shared all the data.
Wow.
We supported each other. Our platform is also like supporting that to collaborate, work together, share the data, and build together the new diagnostics, the new therapeutics in the future. So that was really exciting to see.
That's incredible because that's very rare, as we know in our field. Us scientists, we really like to hoard on our experiments, our discoveries, and keep them for ourselves. So it's unfortunate that in times like that, we are forced to come together. But it sounds like it was an organic process for a lot of us, right? Like, and so I hope that we can do more and more of that, as scientists and clinicians, moving forward on other great discoveries, not just a pandemic, right? Like cancers, et cetera.
Absolutely. One of the things that I'm very passionate about, and this is kind of a new project that started, but it was very present during the pandemic, like how we can translate many of these scientific data to public health policymakers, and help them to make a data-driven decision, like when to close a country, when to start speeding up the diagnostic capabilities or the therapeutic capabilities, where to put resources. So supporting that, we started to work, and there is a collaboration that just started with discussions to mitigate a platform for UN
Mhm.
representatives and scientists and bring them to the same
Oh, wow.
room, and help them to start this conversation on different fields, not only infectious disease, but anything that's urgent matter and should be discussed between scientists and policy house makers.
Yeah, it's time for us to be more of a proactive, right, society in these situations rather than a reactive society. If we didn't have all the innovation and the foundational work, like you were stating, your company, you were already working in this area, you already developed the technology, and it's almost you just had to pivot the direction on what infectious disease, right, to design it on. If you had to start from scratch, can you imagine the amount of time that it would take? And we probably, as a society, wouldn't have diagnostics, let alone vaccines, right? For us to come back to our everyday normal way of life, as we like to say today.
Absolutely. And there are a lot of projects that's still happening right now, like the 100-day project, how we can get ready for a new emerging infection in the future, and how we can support that on every level of the healthcare system. So diagnostics, therapeutics, and prevention as well. But also, I think pandemic taught us a lot of things, like how we can adapt, quickly change, pivot. I think that's the strength of startups for sure. But I know that that was hard for my team to manage that, but we came out really strong from that experience.
What are the ugly realities of global health disparities, and how can science contribute to addressing them?
Oh, that's a heavy question, I believe.
Especially in today's environment, right? With the grants and the specific words that you can't put in your grants.
Yes, I am still hopeful. As you mentioned, that we need to be proactive. We can't wait until a new virus or resistant bacteria will emerge, and we won't have the tools, diagnostics or therapeutics to fight against that. I think the pandemic taught that we could have been responded way faster and better. I think we learned a lot from that, and we tried. We are trying to use those learning points, what we could do next. What's going to happen? It's quite challenging. I think we need not only government support, but also potentially the private sector to step in and support these efforts to help fight against the next emerging infection disease.
So true. I mean, it's not that I, right? It takes a village. It's not just science and medical, but it's also the, policy and Capitol Hill, et cetera, to support us to ensure that we can make these changes effectively for patients and individuals.
And I think public health was a little bit isolated prior, but I might be wrong. But I feel like during this pandemic, it taught us really too that it has to be an interdisciplinary collaboration and support from all over, from the prevention, diagnostic, and therapeutics group, and all the stakeholders from the regulatory side as well, to be able to bring these innovative new future technologies to help us.
I think just looking at you and looking at your Keith Haring painting behind you, that's a HIV virus
No, that's
representation.
actually COVID, and
Oh, it
that's
is COVID.
my role
Okay.
model, Katalin Karikó, who received the Nobel Prize on for her work working with the mRNA vaccine. So this is a painting from a Hungarian artist, and I really love this. It really represents a lot
Yes.
of things, but yeah, it's great to always
No, I
get
love it. I was
something
thinking
done.
Keith Haring a little bit because also he was part of the whole HIV/AIDS crisis, and I'm sort of putting the parallels together that that was probably one of our, at least in my lifetime, one of the biggest public health crisis, right? And now the pandemic, and here we are. They all sort of merged together.
Absolutely. Potentially in the future, we're not going to name the generation based on like alphabetical
No.
letters, but like through like what kind, and not the techno yet the technology drives the naming, but maybe in the future, what kind of virus been circulating.
So let's talk a little bit more about your personal challenges and journeys as a woman in science, and take a step back a little bit. You obviously you came through the ranks of academia and you got all of your training and you're in the startup world today. Could you kind of touch upon that? What kind of challenges existed for you that were unique to each of these worlds because they are two totally different environments? And what is it in particular being a leader as a woman in science in both of these areas?
Yeah, I really like to talk about this actually. So
Well,
I'm
good.
very excited to be here today on this podcast, but I can even start going back a little bit farther and like as a kid growing up.
Yes,
I
please.
I remember when my mom asked what I want to be when I grow up, and I said I want to be a doctor because I loved the all the miracles around the human body and how perfect it can be and how imperfect it can be. And it was quite challenging to be a doctor, right? Like so, and especially for a woman, for a girl to choose this career. So they were definitely worried about me, but I'm really grateful for my parents because they always supported me that I can be anything I want to be. But I can tell
Incredible.
a lot of layers, like adding the hospital and the medical school system to this. I remember one example when I spent my summer surgery rotation in a hospital, in an orthopedic hospital where there were only men surgeons. So when
Mm,
you enter the surgery room to change your clothes, there were no changing specifically for the women
wow.
doctors. So we had to figure out how they gonna manage me being there the whole summer, so that I can get to the surgeries every day in and out. So uh,
Wow.
I think there was definitely a gender gap, especially in Hungary prior. That's not changing, absolutely. So I think there are more medical students now than male. So I think that's really great. Um, and then throughout academia and the startup world, I frequently found myself being the only female in some of the, for example, technology conferences or like AI focused conferences. That's again, I feel like at this point now changing. And I never felt threatened by it.
Good.
But it was always, I know that like I had to spend a little more time to convince the others why am I in the room, right? Like and that's something that I know I was always working how I can bring value into the room to the conversation that they understand like I have a place there and I kind of have this I need to prove that, but I'm very excited
Yeah.
because I frequently can leave the space like it was a great conversation or I got a value or I learned something from this person. It takes a little bit of time, but I like this challenge, and I think one of the other important thing to surround yourself with very successful women. So I have
Mm,
only good experience with women. Maybe it's also because we work in a special niche of like women health sometimes, where I feel like there is even a
hmm.
close tight collaboration and support one to another. But I think just surrounding myself, I know like just looking at my sister, my best friends, and in New York, many women who I meet and talk, they are always inspiring. They are doing something inspirational. So that really helps me understand that like we have a place at the table and we can definitely just live with our mission and go forward where we need to be to help and support what we are passionate about.
That's incredible. No, you do have an incredible team. I mean, you have a female CEO, you have female scientists, right, leading in the charge and working the bench. So I
Yeah,
can't
I
agree
wanted
more
to
that,
mention that, yeah, I'm very lucky, I would say, that
yeah.
I have a female owned and female CEO in our company, and I learned a lot of guidance throughout my years from her as well. And also, I'm trying to build that in our team. So I know I mentored a lot of our team members or other people from other companies. And one of my favorite thing when I am like supporting them, teaching them, helping them with negotiation for stand out themselves, give them space,
Mhm.
and then sometimes they use it against me, and I'm very proud to look at them like, wow, you learned that you stand up for yourselves. That's great, and I'm gonna support that. So I'm excited about some of those moments.
That's amazing. Yeah, I always like to say strength with kindness is a good way to be, right? So you don't have to bully your way through. I think confidence and listening to others in the room is a powerful thing.
Being a female, I think one of the characteristics is like this emotional intelligence.
Oh, yes,
And,
yes.
and
Let's
I
touch
think
on that a little bit.
and and I think yeah, that's something that we can use. I believe they tried to use against us in the
Mhm.
past, but I think that's something that just listening and being sensitive to others in the room can take you far. Um,
I love that. I couldn't agree more on that one. It's not a sign of weakness, it's actually a sign of strength.
yes, yes, absolutely.
Well, let's talk about your speaking engagements. I think one of the most powerful and reputable invitations was at the UN recently. I can't even imagine what that was like, representing a woman in science and a leader. So, could you kind of just give us a bird's eye view takeaway of what that experience was like? And during that time, was there an aha moment for you where you actually saw somebody in the flesh or met them that you never thought you would meet in your career?
Yeah, it wasn't that recent. I think it was prior to the pandemic, but quite exciting moment. I UN has a special place in my heart. I feel like there are very important things happening there. Um, and being invited to talk about the role of women in science and how important the diversity and to support the minority, which is women, unfortunately,
Mm.
um, and how we can support that. Why is it important? What's the value that a team of both gender can bring to the table and into the discussion? I think it's quite important.
Well, hopefully someday I get that experience because I only experience it here living in New York when my roads are blocked, Secret Service, and there's a lot of UN leaders that live in a lot of the, brownstones here in Manhattan. So I've never had the privilege though of being there on site. That's incredible. And are you continuing to work with the UN, it sounds like, in some of these organizations?
Yeah, there is a collaboration that started coming out from CUNY and one of the professor, Dr. Charles Marty, who started kind of this, and also Tamás Novák, who is the innovative and technology attaché of the Hungarian consulate here. So they started this and involved more and more scientists to, again, like support these communication between the policymakers and the scientists. And
Nice.
it's a lot of different topics around sustainability, lot of environmental topics, but also others will be covered and discussed.
Well, listen, I know we're coming on time here. So I have one last question for you. I believe that all women have a superpower. What would you say yours is?
Mine is the Hungarian language that I speak.
That's amazing. I
It's
love that.
one of the hardest language, yeah, and sometimes tricks my brain, and definitely kept my very strong accent. But I love that I have this secret language that nobody understands, and I can talk to my dog secretly that nobody understands.
Well, I'll have to say that you speak your English beautifully and you speak it as fast as a resident New Yorker. So I think that helps as well with with that superpower. So well, take that one for yourself. I don't think many other people, except for from your country, like, right, share that superpower. But you have your own unique language in itself, Dora, and it's really been an honor talking to you today and working with you. And I'm really excited to release your story out into the world and hear from other people how you inspire them based on the journeys, the trials, and the tribulations that you experienced to get to where you are today. So thank you again.
Thank you so much. And as always, it's very exciting to talk to you. So I really appreciate your friendship and career advice and kind of the mentorship that I'm getting from you.